Hello everyone, how are things going? This is Dr. Aiyan from the Veterinary Anatomy channel. Today we will talk about the nasal cavity, oral cavity, larynx, pharynx of the ox. So let's get started. So here we have the head of the ox. What we've done actually, we cut the head longitudinally in the middle of the head, exactly, so that we have just the right half of the head here. What we've done actually, we also cut the nasal septum and remove it this way so to be able to see the structures inside the nasal cavity. So this is here the nasal septum. We cut it completely and now we will remove it so that we can see the structures inside the nasal cavity. In general, we have three main cavities inside the head. The first one is the nasal cavity, this cavity here. We have the oral cavity where we have the tongue, and we have the cranial cavity, the place where we have the brain. Here we can see the cerebrum, the right cerebral hemisphere. We have the cerebellum in this area here, and we have the brainstem, and finally the medulla oblongata to the spinal cord. So the brain is located inside the cranium or the cranial cavity. In addition to these three cavities, the nasal cavity, the oral cavity, and the cranial cavity, you can also find some small cavities inside the bones called the paranasal sinuses. The paranasal sinuses are empty spaces located somewhere inside the bones of the skull, and they are lined from inside with a respiratory mucosa. Why respiratory mucosa? Because all of these sinuses are somehow connected to the nasal cavity. So we have here the frontal sinus. The frontal sinus, I just want to remind you that the frontal bone is very big in the ox, and this is all the frontal sinus. Here also, let me just open, this is the hard palate. This is the hard palate, which separates the nasal cavity from the oral cavity. And of course, the hard palate, the bony structure of the hard palate is formed by the horizontal plate of the palatine bone. Here we have the palatine process of the maxilla, and here we have the palatine process of the incisive bone. Here we just in the middle of the head, and that's why we can remove this somehow like a septum, and here we will have access to the palatine sinus. So the palatine sinus in the ox is really huge, big comparing to other animals. I will try after that to remove this part of the bone to show you exactly the palatine. And let me do it and come back to you. As you can see, we remove the bones from this area here, and now we have access to the palatine sinus. It's really huge in the ox. Okay, as we are talking about the hard palate in this area, the hard palate is lined here with the cornified mucosa, as you can see here, and is continued caudally by what's called the soft palate. So the soft palate, this musculomembranous structure starts from the caudal end of the hard palate here and moves backward, and here at this area we can also describe what's called the pharynx. The pharynx which provide the way for the food and water, and at the same time the way for the air to go into the respiratory system, and from here to the larynx and to the respiratory system. So this pharynx could be here in this area divided into three parts or three rooms. That one located just caudal to the nasal cavity, this area called the nasopharynx. This is the nasopharynx. The area here in this place here, caudal to the oral cavity, called the oropharynx. So this is the nasopharynx, this is the oropharynx, and the rest here of the pharynx, which continue with somehow with the larynx, called the laryngopharynx. The laryngopharynx. So the pharynx is divided into nasopharynx, oropharynx, laryngopharynx, this area here. Again, in this case, the soft palate separates somehow between the nasopharynx and the oropharynx ventrally here. Okay, let's start with the structures which we can see inside the nasal cavity. Inside the nasal cavity, as you can see here, we have three what's called the nasal conchae. So we have dorsally here the dorsal nasal conchae. We have here the ventral nasal conchae, and here in this area we have the middle nasal conchae. So this is the middle nasal conchae. Here, arising from the ethmoid bone, just to remind you, the ethmoid bone forms the nasal wall of the cranium or cranial cavity, or the rostral wall of the cranial cavity. From the ethmoid bone, we can see some small conchae arising from this bone, and that's why we will name them ethmoidal conchae. Ethmoidal conchae. Here I can see 1, 2, 3. Again, here we have the dorsal nasal conchae, we have the ventral nasal conchae, the middle nasal conchae, and the ethmoid conchae. This here arising from the ethmoid bone. Okay, as you can see, between the nasal conchae there are what's called the nasal meatus. Nasal meatus. We have also three nasal meatuses. The first one located between the dorsal nasal conchae and the roof of the nasal cavity, or in this case the nasal bone. This is the dorsal, where I put the catheter here. This is the dorsal nasal meatus. This is the dorsal nasal meatus. The second meatus located between the dorsal nasal conchae and the middle nasal conchae. This meatus called the middle nasal meatus. The middle nasal meatus, where I can push, look, I can see the catheter coming here, if you can notice that. So this is the middle nasal meatus between the dorsal nasal conchae and the ventral nasal conchae. The main nasal meatus, and the biggest one, is that one which is located between the ventral nasal conchae and the floor of the nasal cavity. And the floor of the nasal cavity, this one here, called the ventral nasal meatus. And this is here the meatus which we are using for, which the animal using for breathing, because if you put something into this meatus, you will end up finally here to the pharynx, and from there we can decide to go, if we are talking about endoscope, for example, we can decide at this level here to go to the cevicus or to the larynx, to the cevicus and or to the larynx, or we can at least examine the pharynx area with our endoscope. Or if you want, for example, to push a nutrition tube, to take sample from the stomach, or to inject something directly to the stomach, in this case, please remember to use the ventral nasal meatus. And how to do that? In this case, you have, once you put the nutrition tube into the nose, you have to guide, the tube ventrally so that it will move inside the ventral nasal meatus. Because if you go through the nostril into the, let me just push it this way here, into the dorsal nasal meatus, or into the middle nasal meatus at the end, you will end blend here, so you cannot continue to the pharynx. So again, if you want to go to the pharynx, you have to use the ventral nasal meatus, as you can see in this video here. So now let's move and talk about the oral cavity. The oral cavity from the mouth up to the oropharynx here in this area is the place where we have the tongue. So this is the tongue. The tongue is a muscular structure. Here, as we cut the tongue in the middle, we can see the proper muscle of the tongue. Or musculus proprius lingua. So this muscle here, where the fibers of this muscle are oriented in three directions. Perpendicular, we have the transverse muscle fibers and longitudinal muscle fibers. And because of all of these different directions of the muscle fibers, the animal or even human can move the tongue in all directions. In addition to these muscles here, we have also external muscles of the tongue, including, as you can see in this picture, this muscle here, which starts from the chin here up to the tongue, inserts to the tongue. This is the genioglottal muscle. Look at the muscle fibers directed toward the tongue. So this is the genioglottal muscle. Just for your information, under the genioglottal muscle here, we have another muscle which starts also from the chin here and inserts to the base hyoid bone. This is the base hyoid bone, and this is here the geniohyoid muscle. This is extremely important. We will talk about it later. I tried also to dissect another muscle here, extends between the stylohyoid bone, so this is the stylohyoid bone here, up to the tongue. I hope it's clear. This is the tongue, and here this is, the let me show you the hyoid bone, and specifically here the stylohyoid bone. So this is the right half of the hyoid bone. So from the stylohyoid bone toward the tongue, here we have another muscle called, this muscle here called the styloglottal muscle. Another muscle was here, we just cut it, comes from the base hyoid toward the tongue, the hyoglottal muscle. We cut it here. Good. As we are talking about the tongue, let me tell you that the tongue in ruminants, and of course in this case in the ox, has this projection on the upper surface of the tongue called the torus lingua. Torus lingua here specifically for the ruminants. In front of the torus lingua here, this area, this depression here called the lingual fossa. This is the lingual fossa. In general, we can divide the tongue into different parts. So we have here the lingual apex, or the tip of the tongue. We have the body, or corpus lingua, or the body of the tongue. And we have here the root of the tongue, or radix lingua. Again, apex, corpus, radix. Tip, body, root of the tongue. Good. On the outside surface of the tongue, as you can see here, we can find the lingual papilla, including the fungiform papilla, the filiform papilla, the valate and foliate in this area here. So we will talk about the lingual papilla in another video, where we are going to compare between the different animal species. Okay, and this, let me also tell you that under this muscle here, under the tongue, we can find this big artery. This big artery is the lingual artery, which is a branch of the linguofacial trunk, which comes from the external carotid artery. So just under the tongue, I hope it's clear, Now here we can find this artery. This is the lingual artery. The lingual artery moves along the ventral surface of the tongue and gives a lot of branches, as you can see here and there, to the tongue and the surrounding structure. What is this? This is the lingual artery. Lingual artery is a branch from the, here in this area we can find, this is here the lingofacial trunk, which comes, as you can see here, from the external carotid artery. So the external carotid artery at this level gives two big branches. The first one moves toward the head this direction. I can see it here. This is here the maxillary artery, and the second one is the lingofacial trunk, which will give us later the facial artery, which moves laterally to the face, and under the tongue here we can see the lingual artery. Here at this level also I would like to show you that in this area we can find several structures, you know, here down or below the lingofacial artery. Here we can see a very important nerve. This nerve here is the hypoglossal nerve, which is the cranial nerve number 12, leaving the brain through the hypoglossal canal and finally moves here under the tongue and gives a lot of branches to the tongue and the lower structures. This is the hypoglossal nerve, which is located next to the lingofacial trunk. In this area also we can find another nerve called the glossopharyngeal nerve. From the name, this is the cranial nerve number 9, which will give at this level two big branches, one to the tongue called the lingual nerve and one to the pharynx called the pharyngeal nerve. So this is the three structures which, you know, we can actually see just next to the stylohyoid bone. This is the stylohyoid bone. Okay, this is the stylohyoid bone. So again here I would like to talk about the geniohyoid muscle. The geniohyoid muscle extends between the chin here and inserts to the base hyoid bone, like this. In this case, contraction of this muscle will move the base hyoid rostrally, which will cause that the epiglottis, so we have just the half of the larynx here, the epiglottis will move caudally and close the glottis, or which is the opening of the larynx. Let me show you that in this here symbol. So while swallowing, the animal contract this muscle, or this muscle will be contracted, moving the base hyoid rostrally, which will cause that the epiglottis, this is the epiglottis, will move caudally and close the opening into the larynx. So the opening of the larynx here called the glottis. So the glottis is not the structure, but it's just a space, or this opening here. Moving, the contraction again of the geniohyoid muscle will move the base hyoid rostrally, which will cause the movement of the epiglottis caudally to close the opening of the larynx, the glottis, to allow the food and water to move toward the esophagus. Where the esophagus here, we also cut it here. So the esophagus at this level is located just dorsal to the larynx. So this is here the opening to the esophagus, and this is here the opening of the larynx, the glottis, like this. At the beginning of the neck here, the esophagus is located dorsal to the larynx. Once they move into the in the neck, so the esophagus will move and is located on the left side of the trachea. And finally, when they enter the thorax, they will, the esophagus will move again, and it's located there dorsal to the trachea. Again, so this is here the respiratory system, the opening of the respiratory system, and here we mean the glottis inside the larynx, and dorsal to it we have the cervicus. As you can see here, in normal situation, the soft palate moves caudo-ventrally in this area here, allowing the air to move through the nose to the nasopharynx, to the pharynx, and finally to the respirator or to the larynx, and from there to the trachea and to the lung. During swallowing, the food should move in this direction toward the cervicus, and in this case, firstly, this muscle will be contracted. The epiglottis moves caudo-dorsally like this and close the glottis. The soft palate moves dorsally somehow to allow the food to go to the cervicus like this. So here in the wall, or in the lateral wall of the oropharynx, in this area here, we can find a small opening. Let me show you exactly what I mean. So in this area here, we can see this opening here. This opening, I hope it's clear. Wait, I can put my finger here. So this opening is the opening into the palatine tonsil. So the palatine tonsil is located there in the lateral wall of the pharynx, in this case the oropharynx. And what I have done here, so I dissected, the mucosa here to show you exactly, the structure which is located there. This is the palatine tonsil. Again, located in the lateral wall of the oropharynx, and this is here the opening to it. Okay, so don't forget that the palatine tonsil is located inside a small fossa in the carnivores called the palatine fossa, while in equine, for example, instead of having one big palatine tonsil, they have like we've learned, a lot of small lymph nodes located in this area, in the lateral wall of the pharynx, which represents, of course, the palatine tonsil. Here, from the tongue, I forgot to tell you that from the tongue to the floor of the oral cavity, we have this fold called the frenulum. This is the frenulum. It's like a membrane, extends between the ventral surface of the tongue to the floor of the oral cavity, the frenulum. Here, caudally, there's a fold extends between the tongue to the soft palate. This fold is formed just like here, this fold here. Let me just show you the fold. This fold called the palatoglossal fold. The palatoglossal fold, in some books you may find, they name it as palatoglossal arch. The palatoglossal arch. So in a previous video we talked about, once we talked about the muscles, the superficial muscles there on the other side, we mentioned two main lymph nodes. The first one was in front of the parotid gland called the parotid lymph node, and the other one in front of the mandibular lymph gland called the mandibular lymph node. Here in this view we can see, or let me just tell you that behind the caudal wall of the pharynx in this area we have two lymph nodes on each side. We have the lateral retropharyngeal lymph node, from the name retropharyngeal, behind the pharynx. Retropharyngeal lymph node, we have the lateral and the medial, and here in this cut, in this view, we can see the medial, or cut inside the medial retropharyngeal lymph node. As you can see here, is located directly behind the caudal wall of the pharynx. The retropharyngeal lymph node, in this case the medial one. The lateral will be more to the lateral side. So in general, the main lymphatic tissue found in this area here. So this area is extremely important because the air will move through it, the food, water, whatever will move through it to the body. So we need a very good system, lymphatic immune system in this area to fight against foreign bacteria or microbes and whatever. So the main lymphatic tissue found in this area is the palatine tonsil, which we explained in this video, which we can see in the lateral wall here. And let me just show you this palatine tonsil one more time. This is the palatine tonsil. But at the same time, let me tell you that here in this area we have lymphatic tissue everywhere in the mucosa. But according to the collection of this lymphatic tissue, we can give them names. So we can find some of this lymphatic tissue on the soft palate, dorsally and ventrally here. We can find some of this lymphatic tissue at the root, in the mucosa of the root of the tongue, called the lingual lymphatic tissue. We have also a lot of lymphatic tissue in the wall of the pharynx, called the pharyngeal lymphatic tissue, and so on. So all of them are there to protect the lower respiratory system and the digestive system or whatever the body from foreign factors like bacteria and